Hello friends, welcome to Voice to Nurses. Today also we are going to discuss some nursing related MCQs for the upcoming nursing officer examinations. Let's start. First question. Behavioral clues of impending suicide are all except. Behavioral clues of impending suicide are all except. Options. Gives away valuable possessions. Second option, becomes energetic after a period of severe depression. Third option, withdraws from social activities and plans. And the last option, hypervigilance and exaggerated startle response. Here the answer is fourth option, hypervigilance and exaggerated startle response. Behavioral clues of impending suicide are all. Gives away valuable possessions, becomes energetic after a period of severe depression, and withdraws from social activities and plans. Okay, those patients are going to those patients are having a plan of suicide will not exhibit hypervigilance and exaggerated startle response. Next question. Current jelly-like stool containing mucus among 3 months to 3-year-old child is suspected to have. Current jelly-like stool containing mucus among 3 months to 3-year-old child is suspected to have. Options: Hirschsprung's disease, abdominal hernia, Meckel's diverticulum, indususception. What will be the answer here? Answer is last option, indususception. Okay. There are different kinds of stools are there particular to specific diseases. Rice water stool, which is for patients with the cholera. Rice water stool, cholera. Ribbon-like stool. Ribbon-like stool, it is in patients with Hirschsprung's disease. Clay-colored stool for patients with obstructive jaundice. And for some patients after barium meal intake, they will show a stool with white color. White stool, barium meal intake. And the another one is black tarry stool. Black tarry stool for patients with the upper gastrointestinal bleeding. Black tarry stool, upper GI bleeding. For this current jelly-like stool, one more name is there, old grapes. Old grapes or current jelly-like stool is seen in indususception. And pea soup stool. Pea soup stool is seen in patients with the typhoid. And CD yellow stool. CD yellow stool. A breastfeeding newborn. The babies who are breastfeeding, newborns, are having CD yellow stool. And for formula feed newborns, they exhibit pale yellow to light brown. Pale yellow to light brown colored stool will be there for babies who are having formula feed. Mahogany colored. What is the mahogany color? A reddish brown color. Reddish brown color. Mahogany colored. That is the reddish brown color formed stool. Mahogany color, that is the reddish brown formed stool is present for patients with the ascending colon cancer. CA ascending colon. Next, loose frothy stool. Loose frothy stool for patients with malabsorption disorders, especially for fat malabsorption. The stool the term we are used to tell that kind of stool is steatorrhea. Fat. Okay, malabsorption of fat. Okay, understood this. Next question. The traditional sources-oriented narrative type of charting is characterized by all of the following forms, except the traditional sources-oriented narrative type of charting is characterized by all of the following forms except. First option, database form. Second option, doctor's progress sheet. Third option, laboratory sheet. And fourth option, history and physical examination form. Here they are asking the forms which comes under traditional sources oriented narrative type of charting. Narrative type of charting. It is a type of charting for nurses. Okay, here the answer is third option, laboratory sheet. There are three types of charting for nurses. First one is narrative charting. Second, problem-oriented record. Third one, focus charting. First one is the narrative charting. Narrative charting is the traditional form of charting, and it is a source-oriented record wherein each medical personnel makes documentation on the patient's record in a separate section. Each medical personnel makes documentation on the patient's record in a separate section. Like doctors are having doctor's order sheet, progress notes and all. Nurses are having nurses notes, graphical records, vitals charts and all. Likewise. Example, doctor's order sheet, treatment chart, admission sheet, graphic record and all. Okay. Second one is problem-oriented record. Here we will use the nursing process method, SOPIER method. Subjective data, objective data. A. After assessment nursing diagnosis. P. Plan of nursing action. I. Implementation. E. Evaluation and R. Revision. SOPIER, SOAPIER, SOPIER method is used in problem-oriented record. Third one is focus charting. It is the client-focused chart. Focus charting is the client-focused chart. Here only three contents are there. First is the data. Second is the action. Third is the response. Data, action, response. Focus charting. Data means if the patient is having pain, we will check the pain level using pain scale, and we might see like it is about 7. The pain score is 7, and we will give a tablet or an injection for the patient, and after that we will check it again. Then the pain score will reduce to 2 or 3. Okay, then it is good, right? Okay, that is the focus charting. Next question. All elderly tends to be more susceptible to infection because of. It is a direct question. Options: increased exposure of pathogens, a decline in immune function, third one poor nutritional status, and the last option lack of exercise. Here the answer is a decline in immune function. Next question. Responses to avoid in therapeutic communications are all except. Responses to avoid in therapeutic communications are all except. Just vigilant to this kind of questions. Okay. First option, advice giving. Second option, close-ended questions. Third option, reflecting and clarifying. Last one, arguing and judgmental responses. What can be the answer here? Question is, responses to avoid in therapeutic communications are all except. Do one thing. Everyone please comment the answer of this question below the comment box. Okay. Next question. The classical substances that increases the sensitivity of pain receptors by enhancing the pain-provoking effect of bradykinin. the classical substances that increases the sensitivity of pain receptors by enhancing the pain provoking effect of bradykinin is options nociceptor, endorphins, encephalin and prostaglandins. Classical substances that increases the sensitivity of pain receptors by enhancing the pain provoking effect of bradykinin. Here the answer is fourth option, prostaglandin. We can discuss the other options also. Nociceptor means what? Nociceptor is the pain receptors causes the initiation of pain sensation. Nociceptors are the pain receptors which causes the initiation of pain sensation. Next one is the endorphin. Endorphin is the body's natural pain reliever and also promote pleasure. Okay, endorphins are known as the happy hormones. These are the natural opioids of our body. Okay, happy hormones. It will increase its maximum during what time? During sexual intercourse. Okay, the next one is the encephalin. Encephalin is the pain receptor which helps for the perception of pain. Encephalin, pain perception. Nociceptor, what? Pain, initiation of pain sensation. Endorphin will relieve pain and encephalin, pain perception and prostaglandin provoking pain receptors by stimulating bradykinin. Okay. Next question. HbA1c indicates post serum glucose levels over previous. HbA1c indicates post serum glucose levels over previous. Options 2 months period, 1 month period, 3 months period and 6 months period. Here the answer is 3 months period. HbA1c will reveal the post serum glucose levels over 3 months period. There are some values for HbA1c. If the HbA1c value is less than 5.6, then it is normal. Actually, we are checking this HbA1c to diagnose pre-diabetic and diabetic patients. Okay, pre-diabetic and diabetic patients. So, if it is the value of HbA1c is less than 5.6 it is a normal condition. And the rate if it is in between 5.7 to 6.4, 5.7 to 6.4, then the patient is in pre-diabetic stage. 5.7 to 6.4 pre-diabetes. And if it is greater than 6.5, the patient is in diabetic stage. Greater than 6.5, diabetes. Okay. Next question. Standard precaution requires the use of protective eyewear. When? Standard precaution requires the use of protective eyewear. When? Options. Caring for a patient with cough. Second option. When a wound is oozing blood. Third option. Invasive procedures are performed. And fourth option. There is a danger of body fluids splashing. It is an easier question. Here the answer is what? Fourth option, there is a danger of body fluids splashing. Okay. Next question. When a pulse rate is irregular, it is best to count the. When a pulse rate is irregular, it's irregular pulse rate is there, then we should check. Okay, the best way to count. First option, radial pulse for a full minute. Second option, apical pulse for a full minute. Third option, apical pulse for 30 seconds. And fourth option, radial pulse for 30 seconds. The condition is irregular pulse rate. So, the last two options we can exclude. Then Here 2 options are there. Here the answer is 2, apical pulse for a full minute. Okay, when a pulse rate is irregular, it is best to count the apical pulse for a full minute. Okay. Next question. Gestational diabetes increases risk for the following except. Gestational diabetes increases the risk for following except. Options: prematurity and stillbirth, congenital anomalies, small for date fetus, and fourth option, macrosomia. Okay, except question. Here the answer is third option, small for date fetus. Usually macrosomia will be there for that babies. Okay, so here the answer is small for date fetus. Usually the patients with the gestational diabetes, the fetus will have congenital anomalies might be there, macrosomia might be there, hyperglycemia or hypoglycemic symptoms also will be there, and prematurity and stillbirth will also be happened. Next question. In the liver, bacteria that found their way into portal circulation are destroyed by. In the liver, the bacteria is destroyed by what? Options: cilia, second option hydrochloric acid, third option leukocytosis, and fourth option Kupffer cells. Everyone knows this answer, I think. Here the answer is fourth option, Kupffer cells. The macrophageal action or phagocytic action of the liver is performed by Kupffer cells. Like in this liver, we have different macrophages in all our body. Okay, for different macrophages for different areas of our body, different tissues of our body. For adipose tissue, the macrophage is adipose tissue macrophages. Okay, in bone marrow and blood, the macrophagic action is performed by monocyte. Bone marrow and blood, monocyte. In lymph node, sinus histiocytes are there for macrophagic action. Lymph node, sinus histiocytes. For pulmonary alveolus of lungs, in lungs, dust cell or alveolar macrophages are there. Dust cell or alveolar macrophages are there. In skin and mucosa, it is an important question. Skin and mucosa, the macrophagic action is performed by Langerhans cell. Langerhans cell. Next, central nervous system, it is performed by microglial cells. Microglial cells. In placenta, Hofbauer cell. Hofbauer cell. Skin and mucosa, Langerhans cell. Langerhans cell. Central nervous system, microglial cells. Placenta, Hofbauer cell. And in kidney, intraglomerular mesangial cell. Intraglomerular mesangial cell performs the macrophagic action in kidney. And in bone, osteoclast. Osteoclast is actually a bone destruction cell of the bone, and it is also performing the macrophagic action of bone. And peritoneal cavity, peritoneal macrophages are there. Okay, just remember these things. In this skin, mucosa, central nervous system, placenta, kidney, almost all the points are important. Okay. Next question. Example of autosomal recessive inheritance. Example of autosomal recessive inheritance. Options: craniofacial disorders, hemophilia, cystic fibrosis, skeletal disorders. In the last video also we have discussed about autosomal recessive inheritance disorders 2-3, and here the same the same kind of question is here. An example of autosomal recessive inheritance. Here the answer is cystic fibrosis. Last video we have discussed about the cystic fibrosis, phenylketonuria, and Tay-Sachs disease. These three are autosomal recessive inheritance disorders. Hemophilia will comes under the X-linked disorder, father to daughter to son. That kind of X-linked disorder is seen for the patients with the hemophilia, and it is a kind of inheritance for hemophilia. Next question. Medical asepsis differs from surgical asepsis in that it is aimed at. Medical asepsis differs from surgical asepsis in that it is aimed at. Options: preventing transmission of microorganism. Option 2, preventing entry of microorganisms in the body. Third option, sterilizing all equipment. And fourth option, killing all microorganisms. What will be the answer here? Medical asepsis differs from surgical asepsis in that it is aimed at. Medical asepsis aims at what? Here the answer is, through hand washing we will prevent the transmission of microorganism from one person to another. Okay, for surgical asepsis, by cleaning with painting with betadine and all, we will prevent the entry of microorganisms into the body. Antiseptic wash and all we will use for that. And sterilizing all equipment. Okay, and killing all microorganisms including spores. What we will use for that purpose? Autoclaving and all we will use. Okay. Next question. Preterm labor is when it occurs between. Preterm labor is when it occurs between. Options: 32 to 36 weeks of gestation. Second option, 20 to 37 weeks of gestation. Third option, 24 to 30 weeks of gestation. And fourth option, 16 to 20 weeks of gestation. What will be the answer here? Preterm labor. Preterm labor from 20 to 37 weeks of gestation. Preterm labor is from 20 to 37 weeks of gestation. If it is happened before the 20 weeks or before the period of viability achieved, it is said to be what? Abortion, expulsion of fetus before the age of viability achieved, before 20 weeks. That is the abortion. From 20 to 37 weeks, it is termed as preterm labor. From the completion of 37 weeks to 42 weeks, we will say the term delivery. From the completion of 37 weeks, till 42 weeks, we will say what? Term delivery. And exceeding 42 weeks, after 42 weeks, it is post-term delivery. Okay. Next question. Approach to health is that acknowledges and respect the interaction of a person's mind, body and spirit. Mind, body and spirit within the environment is termed as. Approach to health is that acknowledges and respect the interaction of a person's mind, body and spirit within the environment is termed as. Options: holistic health model. Second option, health belief model. Third option, high level wellness model. And fourth option, clinical model. Strike out these words: mind, body and spirit. Here the answer is holistic health model. We can go through the another options also. Second option, holistic health model means what? Complete physical, mind and body. Okay. This kind of complete this interaction with the mind, body and spirit. Approach to this kind of health is known as the holistic health model. Next one is the health belief model. Health belief model. It is used to guide health promotion and disease prevention program. Health promotion and disease prevention program, and used to explain and predict individual changes in health behavior. Okay, most widely used models to understand health behaviors of individual. Health belief model is the most widely used model to understand health behaviors of individual. Okay, next one is the high level wellness model. High level wellness model, it is developed by a person whose name is Dunn, D-U-N-N, in 1961. And this, according to him, the high level wellness concept, which means a high standard of healthy lifestyle. High level wellness concept means a high standard of healthy lifestyle. Fourth one is the clinical model, and it is the quality performance measure management, care coordination and clinical data sharing. Clinical model comes under the clinical model. What all are there? Quality performance measure, care coordination and clinical data sharing. Okay, these all are the approaches to health: holistic health model, health belief model, high level wellness model and clinical model. Next question, the main cause of genital warts or condylomata acuminata is, main cause of genital warts, condylomata acuminata is, answers, options are Neisseria gonorrhea, second option pelvic inflammatory disease, third option human papilloma virus and fourth option herpes simplex virus. The main cause of genital warts. Here the answer is third option, human papilloma. The HPV virus is the human papilloma virus. Okay, the main cause of genital warts. Okay, it causes the genital warts and also it causes what? Cervical cancer. Okay, cervical cancer also it will cause. Most of the genital cancers also caused by human papilloma virus. And the herpes simplex virus. Herpes simplex virus, which transmits sexually transmitted diseases. HSV1 and HSV2 are there. HSV1 causes sores over the oral area and HSV2 causes sores over the genital area. Neisseria gonorrhea is also a sexually transmitted disease. Usually pelvic inflammatory disease, which is caused by Neisseria gonorrhea, chlamydia trachomatis. Okay, Neisseria gonorrhea and chlamydia trachomatis usually causes the pelvic inflammatory disease for women. Next question. The cleft palate usually gets repaired during. Cleft palate usually gets repaired during. Option 6 months. Second option 3 months. Third option 12 to 18 months. Fourth option 2 to 3 years. Cleft palate. Cleft palate usually gets repaired during 12 to 18 months. The procedure is known as the palatoplasty. Likewise, cleft lip repair is also there, that is known as the cheloplasty. It is usually done during 3 months. Okay, rule of 10 is there for this cleft lip repair or cheloplasty. Rule of 10 include, it is usually they mention the time of surgery. Okay, considering these things under the rule of 10, they will define the time of surgery. Okay, the weight should be 10 lbs. 10 lbs means a unit of pound. 1 kilogram is equal to 2.2 lbs. So 10 lbs means what? 4.5 kg. 4.5 kg. 1 kg is equal to 2.2 lbs. 2.2 pound is the 1 kilogram. So 10 pound is equal to 4.5 kilogram. Hemoglobin should be 10 gram per deciliter and age should be greater than 10 weeks. This is the rule of 10. Rule of 10, weight should be 10 pound or 4.5 kilogram. Hemoglobin 10 gram per deciliter and age should be greater than 10 weeks. It is the correct time for doing cleft lip surgery or cheloplasty. The best time is actually at 3 months. Okay, it should be greater according to rule of 10, the age should be greater than 10 weeks. Okay, I hope you all understood these questions very correctly. One question I have asked previously, and the answer you just comment in the comment box. And thank you for watching this video. If it is useful for you, share with your friends and please do subscribe this channel. Thank you.